Darcy?
Good morning. My name's Darcy Moreno. I'm a provider here in the Treasure Valley. I have been for about 10 years. I'd like to start by saying that I'm very frustrated with Optum and some of the people at the Idaho Department of Health and Welfare trying to do away aggressively and systematically with PSR, now known as CBR, despite Optum's own acknowledgement on page 15 of their RFP, where they state, for 15 years, we have provided utilization management of psychosocial rehabilitation and basic skills training while ensuring these services remain available and improve functioning for children who have severe emotional disturbance and adults with severe mental illness. So they contradict themselves, obviously, with that statement. Also, they are in breach of contract as they don't respond to complaints or written communication within 2 days or at all in most cases. And as you've heard, they're also in breach of contract as you know, with hold times, as they're often in excess of their promise to answer their phone within 2 minutes, as often we're on hold for 3 to 7 hours at times. This week alone, my agency is up to almost 100 hours. As Laura said, she's up to about 80 hours, resulting, the 100 hours that my agency has been on hold this week has resulted in multiple canceled appointments, mostly with children who already have severe neglect and or abandonment issues. I have one provider who, as of yesterday, has canceled appointments for 4 days in a row, trying to get prior authorizations to continue providing services. That's unacceptable. These unreasonable hold times also put undue administrative costs on the agencies, obviously, in addition to loss of income. Our agency has also lost 6 professional employees since October because of the unreasonable burden Optum has put on the providers to provide services to the mentally ill people of Idaho. Another undue burden Optum has put on the agencies: we get daily calls from the State Tax Commission because of the thousands of dollars in fines we owe due to the inconsistent, nonsensical payments we receive from Optum. Despite the repeated claims on behalf of Optum representatives at our provider meetings that they would pay clean claims as per our previous system within 7 days of receiving them. Also, according to the State Tax Commission, mental health agencies, across the state are unable to pay their employee taxes due to not receiving consistent and reliable payments by Optum for services rendered, despite the fact that they have been paid with Idaho's taxpayer dollars. Optum is consistently denying access to needed mental health services due to their vague policies. One example of that, did you have a question? Oh, may I finish my statement real quick?
You may.
One example of that is one of our clinicians called to get a prior authorization for one of our clients whose brother had set her on fire. The authorization was denied because she didn't require a skin graft. It must not have been very traumatic to have been set on fire. Thank you for your time.
Thank you, Darcy, for your testimony. I'm going to ask, before I bring the next presenter up, is anyone here from Optum? Okay, I was afraid of that, but thought I would ask. Thank you.
Mr. Chairman.
Yeah, yes, Senator Agador.
Thank you, Mr. Chairman. The first, I got home last night, and the first that I had heard that we had changed from Molina to Optum was during a phone call I returned to one of my providers in Meridian, in which we spent a lot of time talking about the on-hold time, the payments, all of those kinds of issues. And I'm disappointed that we as a committee have not had some discussions or at least been briefed by the Department of Health and Welfare on this change, why the change was needed, and what's happening to correct these issues. And I'm hoping...
Senator Hagedorn, and we are aware, it's not our time to testify, but we're all aware of those situations.
I'm hoping we'll get some briefs from the department on this.
Okay. Thank you. Okay, our next presenter is Jim Baugh.
Thank you, Mr. Chairman and members of the committee. My name is Jim Baugh. I'm the Executive Director of Disability Rights Idaho. We've been providing free advocacy and legal services and public policy advice since 1978 and in Idaho. And I want to say that we have positions on all of these issues. We support the redesign and expansion of Medicaid. We support the restoration of preventive and corrective dental services to Medicaid populations. We support better contract management with the Optum system. But what I'd like to talk about in the remainder of my 3 minutes is community-supported employment services. Because this is something which this is a bill which I expect your committees will be considering this year. You heard earlier from Tracy Warren about this bill. I notice that a lot of us talk in acronyms and jargon, and sometimes it's difficult for people who don't live in this world to understand what we're talking about. Community-supported employment, or CSE, is a very intense and specialized form of job training. Until recently, there was a general prejudice, a belief that people with developmental disabilities, particularly disabilities like autism or intellectual impairments, that those people couldn't be productive workers and employees. Well, what we've discovered is they can, but for many of those people, they require very intensive and long-term on-the-job training, more than employers are willing or able to provide. And so this method of training people who have these type of disabilities to be able to do job skills is called community-supported employment, and it involves one-to-one, on-the-job training and assistance. We call the people who do this job coaches. Sometimes we call them employment specialists. What's happened here is an unintended consequence of House Bill 260. In an attempt to contain expenditures in Medicaid on developmental disability services, House Bill 260 put in language which said that the department could only make an exception to people's individual services budgets if the person could show that they needed the exception for reasons of health or safety. Employment is not a reason of health or safety. And the unintended consequence is that we, instead of supporting people to become more independent and supporting people to go to work, we created a barrier to work, and we created an incentive to keep people more dependent on the system. We are suggesting a change to that statutory language which would allow employment services as an exception to allow people to modify their service budget if the purpose of that is to obtain or retain their current employment using Medicaid community-supported employment services. We do not have a bill number for this yet, but we hope you will see this bill, and we hope that you will be able to support it. Thank you very much.
Thank you, Jim. And Bill Ben Kula. Welcome, Bill.
Thank you. My name is Bill Ben Kula. I am the president of the Idaho Association of Supported Living, Residential Supported Living Association in Idaho, and I'm here to represent them on one issue and then myself on the second issue. First, I'm here to encourage you to support changing statute 56-255-3E-II, which is exactly what Mr. Baugh talked about. There is, in my opinion, an unintended consequences of lumping supported employment service into this part of the statute as a result of House Bill 260. People with disabilities have lost or have not been able to obtain employment, as supported employment is not necessary in most cases for health and safety as required by House Bill 260. Supporting statutory changes to 56-255 would remedy this unintended consequences, and I urge your support for this change. The second thing I'm here to talk with you about as a personal citizen is I want you to consider the consequences of not expanding Medicaid to the working poor. Not expanding Medicaid will result in increasing number of our state and local tax dollars to continue to go to the catastrophic health fund, which has doubled since 2002. In addition, taxpayers living in non-participating states will bear a significant share of the overall cost of the expansion through federal tax payments, without enjoying any of the benefits. If we fail to act, thousands of hardworking Idaho families will not have access to coverage and will not have protection when faced with health emergencies. On the other hand, if we take advantage of this new incentive for states to increase Medicaid coverage, there will be an affordable coverage option for families that fall below the income level receiving tax credit. Tax dollars not allocated to our catastrophic health fund can either be returned to Idaho citizens, resulting in an overall reduction in taxes, or the money can be utilized to fund other high priorities, such as education. This concludes my testimony in front of your committee, and I thank you for your time.
Thank you, Bill. We'd like to have the young lady that came very far, and Nancy Lavanos and Charlene Quaid. Okay. If you'd come up, please. And I assume you're on our list somewhere, but if you'll state your name, we'd appreciate it.
I was number one. My name is Jessica Chilcott. I'm a licensed social worker. I provide case management services. Our agency provides case management services in Bonner, Boundary, and Kootenai counties. I'm here because I'm frustrated with the implementation of behavioral health services in Idaho under the contract with Optum. First, regarding time spent on hold in an attempt to obtain services. I personally spent 10.5 hours on hold in the last 5 business days without being able to actually speak to an Optum representative. I am aware that my experience, not unusual. Second, I believe that it sets a dangerous precedent to allow, in essence, rulemaking authority to pass to a private contractor, as was done with the temporary rule that took effect in September of 2013. Third, in the time that Optum has administered the Medicaid dollars, providers and clients have been seriously negatively impacted. Reimbursement rates were altered in a manner that forces case managers and other providers to either act in the best interest of their client or to act in their own economic self-interest. As an example, the reimbursement rate for telephonic case management fell to $4.10 a unit. A unit represents 15 minutes of service. Optum claimed that the changes to reimbursement rates were the responsibility of the Division of Medicaid, a statement that is factually incorrect according to the contract manager at Health and Welfare. Optum publications, as well as requirements in the Code of Federal Regulations, known as the CFR, require that case managers participate in assessment and care coordination. At the same time, Optum will not reimburse case managers for this work. I was told by an Optum representative that I was still required to do care coordination because it is a best practice, but that I could not be reimbursed for my time. In doing so, Optum is also failing to ensure that case management is provided within best practice and industry standard guidelines. These policies also fail to take into account the very rural nature of most of our state. Because policies around communications with clients and their caregivers implemented, our agency has 4 parents at this point of time who have been told by their employers that they are at risk of losing their jobs if they have to take any more meetings for their children. An Optum representative told me that our parents should be case managing their children like quote-unquote normal parents. Normal parents do not have to deal with the behaviors, time demands, emotional and economic costs of parenting a child with a mental illness. Because of what I would like to see done is I am asking that the reimbursement schedule be revisited with input from the professionals who are serving the consumers of mental health services in Idaho. I have spoken to multiple professionals who are no longer able to make a living as behavioral health providers in Idaho and are looking to leave the industry and to leave the state. I am asking that the ability to do my job be restored. I and my fellow case managers need to be able to conduct assessments and care coordination activities for our clients. We also deserve to be paid for our work. I am asking that the process for determining level of care be revisited in a manner that meets the needs of Idaho mental health service consumers and providers. And finally, I am asking that the committee reject the temporary IDAPA rule and reopen the period of public commentary for that matter so that consumers and professionals have a legal protection within the rule. I've provided additional documentation that will be attached to you later. Thank you for your time.
Thank you for coming. Nancy?
Hi. I am mother to kids out with different abilities of 6 and 4 years old. First, I want to thank the programs that support and teach the parents, especially This that give information in Spanish and help with the administration process. I would like to mention that these people help regardless of race, sex, color, or economic status. I have come to them many times with so much pain I could barely talk, and I did not know how to explain all of the difficult and unsafe situation my children and I face because of autism. People help me explain the condition of my children's life to the school, therapists, and community. This was the first step to me having a voice that counts and the ability to defend these who are marginalized and cannot defend themselves. People has taught me about my rights and obligations with the school, welfare, and Medicaid. They give me the opportunity to learn new skills in Spanish and practice the skills in English. For example, the IP meeting that I was able to attend alone after my training with Apple has also helped me to go to a parent-teachers conference, understand what the teacher was saying and complete with the teacher's request. Because of Apple, I am able to understand the special needs my sons have, respond to Medicaid emergency, and navigate the changes that are happening to these programs. Thank you for your time, and please support this program. Thanks so much.
Thank you, Nancy, for coming.